Imagine that you are a doctor in a remote area in Africa, and a 2-year-old child with fever arrives at your consultation. His parents say that he only has fever and no other symptoms. He may have a mild viral disease, but in this risk area, he may also have a potentially deadly disease such as malaria. The problem is that sick children look very much alike, irrespective of the diagnosis, and those at higher risk of dying are often difficult to identify. How can you know if your patient has a life-threatening disease? Imagine that you had a tool that could tell you in a few minutes with just a blood draw from your finger if your patient is at risk of dying or not. Fantastic, isn't it? Reducing child mortality is a global health priority. Some diseases kill mainly children under 5 years old. For example, malaria. It causes more than 400,000 deaths per year. This means that by the end of the next 3 minutes, 2 children will have died of malaria. When a child arrives at an emergency room, the initial approach is called triage. In low-income countries and remote areas, diagnosis is a daily challenge. Clinicians are scarce, many medical resources, such as laboratories, are not available, and the nearest facility may be hours away. In these settings, triage made only by clinical impression is insufficient to identify potentially severe patients. To address this problem, we are working on triage tools called prognostic biomarkers. These biomarkers are proteins that are released to the blood when the inner layer of the blood vessels, the endothelium, is damaged. This biological pathway is called endothelial cell activation, and it is a common pathway of injury in many life-threatening infections, including sepsis, malaria, or even COVID-19. These biomarkers can be measured right next to the patient's bed with a small portable device, and will tell you in a few minutes if this child is at risk of dying or can be safely discharged home. This is like a prognostic traffic light. If your markers suggest red light, you can anticipate your treatment, maybe admit him, or transfer him to a bigger facility. Using these biomarkers, not only for malaria, but for many deadly diseases, can prevent thousands of deaths. Do you remember the child you were attending at the beginning? Fortunately, he is fine. Also, you have measured his prognostic biomarkers, and they are very low. This is a green light. So don't worry, you can safely send him home.